And welcome to Nurse Table Talk. I'm Nurse Julie, and by the end of today's video, you have a good understanding and be more informed on why it's so important to take your blood pressure and why it's so important to know those numbers. So taking your blood pressure helps us give us a better understanding of what our risk factors might be as far as heart disease and stroke. Knowing those numbers is a good thing. You can let your doctors know, especially if you notice that the numbers aren't where they normally are. We did do a video on how to take your blood pressure, but this is just a review of some overall facts. So blood pressure, the systolic blood pressure, the top number of your blood pressure readings, it measures the force that your blood is exerting on your artery walls when your heart pumps. The diastolic, the bottom number of blood pressure readings, measures the force of blood against your artery walls when your heart is resting between beats. The American Heart Association recommends that we take our blood pressure twice a day, 2 readings in the morning and 2 readings in the afternoon or evening, at least a minute or 2 minutes apart. It's best not to consume caffeine, do exercises, or smoke 30 minutes prior to taking your readings. And then keep a journal so you know what those readings are. And after a period of time, I don't know, maybe like 2 weeks, you'll know what your numbers are. So when somebody asks you, hey, do you know what your numbers are? You can let them know that these are my baseline numbers. If you change doctors and they say, hey, what's your blood pressure normally run? You can let them know because you've been doing it. The wrist cuff is known to be really sensitive to position change. So you want to be aware of that. And when people live alone, sometimes it's hard to manipulate the manual cuff. So, and then they give up and they get frustrated and they won't take it at all. So maybe the wrist cuff would be a better fit for you in that, situation. The American Heart Association recommends using the manual cuff because it's more accurate. But again, you can take both of your cuffs, whatever type you want to use, and take it to your doctor's office and have them check your pressure. And then you can use your device and compare it to theirs. The American College of Cardiology and the American Heart Association updated their blood pressure guidelines in 2017 to recommend that men or women age 65 or older should aim for a blood pressure reading of lower than 130/80. Ideal blood pressure is noted to be below 120/80, and elevated blood pressure is noted to be 120 to 129/80. Then you'll see the numbers for what stage 1 is and also then stage 2. So the good news is that high blood pressure can be treated through diet, exercise, and even medications. You and your doctor will just, pick the best fit for you. Thanks for watching, and we'll see you next time.
Like the content you just watched? Hit the like button or hit subscribe here. If you want to be notified of any future videos, please ring that bell. If there's any topic you'd like to see discussed, leave us a comment in the comment section. Nurse Table Talk. Save time, save money, be informed. Thanks for watching.